Good morning, everyone. Thank you for this opportunity to be here. My name is Torrence Williamson, and I'm with CHERUBS. We are a nonprofit organization that works with families of babies born with congenital diaphragmatic hernia. We were founded in 1995 with 2 members and a typewriter on my kitchen table. We are the world's largest nonprofit organization for CDH, and we were the first in North America. At 20 years old, we now help over 5,500 families in 60 countries. We are run by 2 employees and approximately 50 volunteers. We fund research, we raise awareness, and we provide free support services for families. A little about the demographics of our charity. Our membership includes 142 medical care providers, 2,912 CDH survivors, 1,562 non-survivors, 845 unknown, meaning families who have not updated their statuses since their children were born, and currently 31 babies in utero. The map of where our membership is geographically. Priscilla asked us to pull together some data to talk about long-term care for our children. So we asked a little bit over 400 families of children 16 and older who were survivors, and we had about a week and a half to pull that data together, and we had 161 patients to respond to us. Of those 161 patients, we had 23 males between 16 and 17 years old, 16 females, a total of 39 children who were 16 and 17, and over 18 we had 52 males, 70 females, for a total of 122 who were 18 years and older. Participants for this particular question: what resources do you think are necessary to get care as a patient gets older? We're allowed to give more than one response, and a great general practitioner was the most important need for our survivors, followed by a trained surgeon and follow-up x-rays. For the question, what would you like to continue to see the patient surgeon as he or she gets older? We had a large percentage of our participants respond that they would like to see their surgeon as they get older, but it was a bit distressing to see that a large percentage of our survivors and their families did not know that they should be followed up after adulthood. When asked how often they would expect to see this provider, the majority wanted to meet with PRN, but also we had a large percentage who liked to meet with them once a year. And we had 22 who said they did not know. I'm going to sit on this graph for just a few minutes. What issues do you foresee as the patient becomes an adult? And a large percentage of our participants responded they would like, that reherniation, bowel adhesions, and obstructions were the biggest problem, along with a general lung issues response. Only 2 of all of our patients in this survey did not think that they would have any issues long term. What problems have you encountered with adult care providers? Overwhelmingly, a lack of knowledge about CDH and a lack of current knowledge about CDH. This is the biggest complaint that we have from families of older children. We call them CHERUBS at our charity, is educating the doctors themselves. And you can see the responses of the doctors telling them it's no big deal, it's a hernia, and these are general practitioners, adult care providers who have no experience with CDH whatsoever. How far would these families travel for follow-up care? Overwhelmingly, they would travel 50 miles up to 100 miles. Only a few families said that they would travel extensively, which points out the great need to have more CDH clinics and more CDH long-term follow-up care facilities in more locations. And would you be comfortable with ongoing care with your primary care physician if they were educated on how to manage your condition long term? Absolutely, they all said yes, except for very few. The question is, who is going to be educating these long-term care providers? Who is going to be educating the general practitioners? And how do we go about doing that? How can the transition to adult care be made easier for the CHERUB and their families? More information, more education, and more long-term CDH research data are obviously needed. And that's what we have at this particular moment. We also have a larger study that's going to be published on our charity website in the upcoming weeks with a little bit more in detail data, but overwhelmingly, there's a huge concern for the generation of children who are now making it into adulthood. As you all know, in the 80s is when our children started to survive, and now we have an entire generation who are becoming parents themselves. And they're coming to us with questions of, can I have a child? Is this genetic? What's going to happen if I carry pregnancy full term when I've had CDH myself? Is that going to cause any physical problems? And then who do I go to see as a general practitioner or an obstetrician when they have never heard of CDH and don't know how to take care of me or what to look for? And as more of these children grow, the more questions we have come to us. So we're really interested in the research that you are all putting together and your input and your plans for the CDH community long term. And I appreciate this opportunity to speak to you all. Thank you.